Hello, this is Maggie Fox, President and CEO of the Climate Reality Project. Thank you all for joining this webinar, which is the third in a series of what we call the Cost of Carbon Pollution webinar series. Today, we have more than 1,200 people joining this webinar to learn more about the crucial intersection between climate change, health impacts, and health care. I'd like to invite everyone to visit climatereality.com to learn more about our work and also to register to become a climate leader. We also want to urge you to join the Healthcare Without Harm website to follow their work more directly, as you will hear about today. Our Cost of Carbon Pollution series, with the help of partner organizations doing extraordinary work like Healthcare Without Harm, is about understanding that we're all already paying a very high price for carbon pollution in numerous ways, some of which include insurance, health, food security, and many other areas that we will cover with future webinars. We'll be accepting questions through the chat function of this webinar, and we'll select several questions from the audience. We're also encouraging a live conversation about this webinar on Twitter. You can follow the discussion by going to Twitter and searching for #CR_HCWC. I'm excited to introduce Gary Cohen, the Executive Director of Healthcare Without Harm. He's actually an amazing gentleman, and we're so happy to have him and the great work that he's done to share with you today. He's worked at the intersection of the environment and health for the last 30 years. In 2006, he received the Skoll Award for Social Entrepreneurship, and last year the EPA awarded him an Environmental Merit Award in recognition of exceptional work and commitment to the environment. And just recently, he was named a Champion of Change by the White House and will be recognized at the White House on July 9th. Gary, we'd love to hear just a little bit of introductory remarks to you about the overview between healthcare impacts and climate change. Welcome.
Thanks so much, Maggie. Healthcare Without Harm has been working for 17 years to bring a sustainability imperative into the healthcare sector. Healthcare, especially in the United States, embodies all of the contradictions of a system that's powered by fossil fuels, toxic chemicals, and industrial agriculture. So hospitals are major polluters. But because of their healing mission, clinicians have a moral imperative to understand the essential links between the environment and the epidemic of chronic diseases that affect the majority of Americans and keep our hospitals filled with patients. So our strategy has been to bring this latest science linking the environment and health to the sector and to get hospitals to clean up their own houses. That means to kick their addiction to fossil fuels, to detox their supply chain in favor of safer products and chemicals, and to transition away from serving processed junk food to patients and employees and move to serving healthier food and even supporting local and sustainable agriculture. So as one example of our approach, we were able to work with all the hospitals in the country and pharmacy chains to stop using mercury thermometers and blood pressure devices in favor of safer alternatives. Healthcare was a major source of mercury pollution, and scientists have been telling us that children are being born with dangerous levels of mercury in their bodies, enough to affect their brain development. So in this advocacy campaign, which eventually led to a United Nations treaty to phase out mercury from healthcare globally, nurses were critical change agents in their institutions as well as in the policy realm. So during this webinar, you will hear a lot more about how nurses are playing a similar catalytic role in addressing climate change. Our analysis leads us to the conclusion that healthcare has three critical leadership roles to play around climate change. One, as anchor institutions in their communities, hospitals have a responsibility to use their economic and political influence to accelerate the adoption of policies and practices that promote climate and public health. Second, as major consumers of energy, the healthcare sector can play a leading role by aggressively increasing their energy efficiency, reducing their reliance on fossil fuels, and making the transition to renewable energy sources. And three, as trusted and stable community members, hospital employees should engage in personal and civic activities to become climate champions, as your organization is also working toward. And in the United States, there are over 5 million healthcare workers. So now you will hear from a number of nursing leaders about how these 3 critical roles are playing out in the real world.
So Gary, well, how about you introduce the nurses that will be with us today, and then specifically we'll ask some questions of them and of you that I think will get at the heart of helping people understand this really critical intersection between climate change and healthcare and health impacts.
Well, the first nurse I think that we're speaking to is Laura Anderko, who is a professor at Georgetown University and has been a major author and nursing champion around the links between climate change and health, and actually worked with the Catholic Health Association to draft a critical guidance document for their constituency about the links between climate and health.
Wow. She's also holds the Robert and Kathleen Scannon Endowed Chair in Values-Based Healthcare at Georgetown, and is a scholar and educator in the fields of epidemiology, public health, and environmental health. A Robert Wood Johnson Executive Nurse Fellow, Dr. Anderko, and earned her PhD in public health from the University of Illinois and MS from Northern Illinois University, and a BSN from University of Illinois. Clearly, Laura has a lot of great background and skills, and we're excited to hear from you. What about the other nurse that's joining us, Gary? Would you like to introduce her too, please?
Could you do that? Because I don't have
Sure.
Beth right in front of me.
Absolutely. So Beth is an MHIR nurse who has been nursing for 25 years, which in and of itself is an enormous accomplishment, with clinical experience in critical care, women's health, and has had a long interest in the environment and has been working as a sustainability coordinator at St. Patrick's Hospital since 2008. Good for you, actually, Beth. That's extraordinary. Beth has earned a BA in botany from the University of Montana, a BS in nursing from Montana State University, a master's in healthcare innovation from Arizona State University, and is now a candidate for PhD in nursing at Washington State University. You too, Beth, bring an enormous amount of experience and education to this conversation, so thank you both for joining us. I'm real happy to have you and thrilled to have your voices and your experience to share with others who have joined us for this webinar. The first question for us is, what are the health costs and overall health impacts of climate change? Laura, would you like to take that one?
Sure, Maggie, thank you. As you might imagine, climate change is about the world, and so the impacts on health and the costs are huge. And we're only really beginning to link evidence between these health impacts as they relate to climate change. The World Health Organization in 2000 reported that since the 1970s, climate change has contributed to approximately 150,000 deaths per year, which did not consider all causes of death. And the global economic value of loss of life due to climate change has been estimated upward near $88 billion. And so we're looking at, again, preliminary data, preliminary numbers, as we begin to really look at the full range of health impacts that we're experiencing. In 2007, the Intergovernmental Panel predicted that extreme weather events would lead to extreme health impacts. And we're already beginning to see these in our emergency rooms and in our hospitals as well as our communities. This slide just gives us a snippet of some of the range of health impacts that we are beginning to link with climate changes. And some of them we're pretty familiar with, such as asthma, and we'll go back to asthma in a little bit. But I lived in Chicago during the heat wave that killed hundreds of people. Communities are beginning to look at adaptation plans, which we'll talk about later as well, to respond to this. We're looking at food security as a result of droughts. So particularly across the world, we're seeing less and less rainfall and more issues related to agriculture, not being able to grow the crops that they had in the past. Droughts can be counteracted again with some areas that are getting extreme flooding, which increases the problem of water issues and bacteria and red tides. Some of the lesser known things include vector-borne disease. We're seeing an increase in Lyme disease and dengue fever and malaria, even in the U.S. As the ranges and the weather changes, the ranges for these insects expand. We're very aware right now with the wildfires in the Southwest, which brings a lot of smoke and chemicals depending on what's burning. That poor air quality can go as far as 100 miles depending on the winds, and can cause extreme respiratory problems in people living in the area. Other lesser known issues include plants, ragweed that is beginning to see a much longer season because it loves the carbon dioxide. So we're seeing an increase in pollen along with the heat and ozone, which creates perfect storm for asthma attacks, particularly for young children and those living in urban areas. Poison ivy, the picture that we see in front center is we're finding that the actual oils in the poison ivy are more virulent and can create much more severe reactions, again, because of its growing season, because of the carbon dioxide and the heat. Next slide. So one of our exemplars, we probably know somebody with asthma, at least one person, and as we're looking at climate change and its impacts, we're seeing more and more children admitted to the emergency room. This data is courtesy of Jessica Kastner from the University of Buffalo, and the Centers for Disease Control and Prevention actually put out this data. As you might imagine, subsequently, we're seeing higher costs per person per year, but for 2007-2008, it was about $56 billion spent for asthma, which a cost per person of $3,300, and 1 in 12 people in the U.S. Were affected by this. We, of course, by 2020 are looking at a significant increase in ozone-related ER asthma visits, not just in New York City, but throughout the U.S. and worldwide. And as I said earlier, we're seeing an increase in pollens and molds and other aeroallergens that, combined with the ozone and the particulate matter and the heat, creates a very difficult situation for many people with respiratory issues.
Thanks a lot, Laura. It's really, even for those of us who are paying close attention to these issues, there's a lot of connections here that are really, people don't realize, and so the value of the work that you're doing in education is critical, because helping people understand that these changes that are occurring are tied to climate change is really going to be important to help people understand how quickly we need to get to work solving this problem.
Thanks, Maggie.
So Beth, as someone who's been out there on the front lines, just like Laura has for many years, what have been some of your experiencing and actually witnessing the health impacts during, for example, an extreme weather event?
Thank you, Maggie, for the opportunity to speak today. Basically, as Laura indicated, there are so many opportunities for climate to impact health. Some of them are subtle, and they would tend to tip the vulnerable into an illness condition, and some are more dramatic, such as from severe weather events or long-term fires. And we know right now, for instance, summers are hotter, especially in the West. I live in Montana, and in the West we're very aware of dry temperatures and high temperatures and oftentimes longer burning fires. And those can be acute events or chronic events for people. So really there's a wide range from heat-related illness that would be dehydration and stroke. Those can lead to cardiac complications from electrolyte disturbance. And as Laura also said, the air quality issues are a serious concern, from allergies to COPD to increased asthma to respiratory disease. And then infectious disease, that's another interesting thing for us in Montana, particularly because we have been spared from many of the waterborne diseases that are more prominent in the tropics and subtropics. And actually some of those are moving north now enough to impact us here. And so that's something that we see in the hospitals and in our clinics quite a bit. In the ED in particular, I wanted to address briefly, just because emergency rooms across the nation are, for better or worse, a public health safety net for healthcare. A lot of people end up going there for some of their primary care or urgent care. And that is a very expensive part of the healthcare system, obviously. But in the ER, we're seeing more of these issues that are listed on the slide that, as I addressed, are directly heat-related or are subsequent to heat and air pollution. And large-scale heat events or severe weather events you've heard about, and of course those impact EDs as well as hospitals. You may remember the flooding from the Midwest of a couple of years ago, or certainly Hurricane Katrina or Sandy, and the devastation to the healthcare system, as well as the difficulty in access to care under that much stress and pressure. But as mentioned, there are also slow and incremental changes as well, and it does typically impact the vulnerable, and that includes children and the elderly or people with chronic disease. And by taxing their systems, their health systems, their physical systems, even just a little bit, it can tip them over into illness. So that is what we see kind of on both hands. One is sudden and severe events, and the other is the slow incremental events that are adding up. I mentioned in the West that we were seeing more wildland fires, and fires have been increasing in intensity and duration over the past 15 years or so. And people argue about why, but at least in part it's because of increased dryness and also increased temperatures. So we have hotter burning fires and longer lasting fires. So we know that fires can cause injury at the site of the fire, but also we get smoke that covers half the continent sometimes in the summer. So these vast areas of land and air that are polluted with smoke and particulates can cause health problems. We know that the evidence is strong that smoke exposure exacerbates respiratory illness, such as asthma and COPD. And there's some evidence that it also exacerbates cardiac problems, from MI to heart failure to peripheral vascular disease. And so I just wanted to tell you about one way a nurse I know and work with is working on this. In Missoula, a nurse named Brooke Krininger is earning her master's degree in public health from the University of Montana. And she's interested particularly in this link between cardiac disease and wildland fire smoke. So she's working with researchers at the university and clinicians in both the hospitals in our town of Missoula. And she will be investigating the emergency department as well as inpatient admissions related to cardiac conditions, comparing those admissions during a high fire season to the same weeks during a less intense fire season. And we have about 12 years of data from admission and also air quality, so this will be interesting. This is an important way that we can measure changes over time in health conditions related to a climate-impacted environmental exposure, which is in this case smoke and small particulates. So we hope that she'll have findings in a few months, maybe about 6 months. And this is just an example of one of many of how nurses are engaging with this topic. Thank you.
Oh, thank you. Actually, Beth, that was fascinating. That actually really goes directly to the next question, which I'd like for all three of you to address. Gary, perhaps you'd like to start it up, which is that it's clear just from this conversation that the key role nurses are playing as change agents within the healthcare sector. Can each of you speak a little bit more about that? It's coming through, obviously, in answering these other questions, but I'd love for you to talk about it in greater depth. And Gary, would you just start us out, please?
Sure. So our experience in general is that when healthcare employees are doing work within their own institutions to address the carbon footprint of their institutions, they feel much more empowered to then play meaningful roles in the broader society. So we found over the last couple of years that we were able to mobilize a number of nurses in different key states around the country to engage in public policy around defending the Clean Air Act and the rights of the EPA to regulate both current coal-fired power plants as well as develop new regulations about coal-fired power plants. And so having nurses who are already doing work in their institutions to then go to the legislatures and regulators and to say, look, as a public health professional, this issue is a health issue that affects our communities. It's a very powerful statement. As many of you know, every year the Gallup poll does a national survey about who are the most trusted messengers in profession. And every year, nurses come up as the most trusted profession in America. So I think they're just absolutely critical as messengers around climate change.
Thank you. Beth, talk to us about some of the things that you are working on and that you know others are working on specifically as change agents within hospitals and in the broader community.
Sure, thank you. Well, as Gary said, there is work going on. There's more awareness all the time about that hospitals are not exactly sustainable creatures. And so there's more work going on across the nation, which is very gratifying. And we work on that at my hospital, for instance, which is St. Pat's in Missoula, and that's one of the things I work on. We have a full sustainability program which covers energy management, waste reduction, toxic chemicals, and staff engagement. And yet today I want to talk particularly about climate intervention. And this touches on hospital sustainability in several ways. Energy conservation and use of renewable energy is probably the most direct. And you may know that healthcare contributes 8% of the nation's greenhouse gases. It's the second highest user of energy in the service sector. Hospitals themselves are 2 to 3 times as energy intensive as office buildings. And most of the energy used across the nation, including in healthcare, is fossil fuel-based energy. So that's one direct area, and there's a lot that nurses can do to push their facilities managers. Most nurses cannot actually change the pumps and generators at hospitals, but they can really influence how they want to practice, and that includes the pollution associated with nursing care. Another way that healthcare impacts climate is really through waste. The EPA says that 42% of greenhouse gas emissions come from our stuff, the materials that are manufactured, transported, and how they're disposed of, and that includes products and food. So reducing the amount of products we use, working toward local foods, keeping what we can out of methane-producing landfills, all help to reduce greenhouse gas production. And nurses across the country are working on this. They're working on making healthcare more sustainable. And also nurses are often the people who can translate the impacts of the built environment or of hospitals on health, as Gary suggested, at the legislative and policy level, but also with our patients and with each other and with other health professionals and with our families. So nurses often can create those bridges. I would also say, just to put in there, it's related to the healthcare system, and that is nursing education. So nurses are working around the nation to change the curricula in colleges of nursing to include awareness of this issue and other issues related to the environment and health. So talking about climate change specifically, a nursing faculty friend of mine, Dr. Phyllis Eide, says, the generation we are teaching now will be nursing in the time of climate difficulty. So we're already aware of climate difficulty right now in 2013, but we imagine that the nursing students today will be practicing for the next 30 years. And so it's really our job as nursing educators to prepare them for that. And that is happening in pockets across the nation, but that's one of the areas that we can continue to work on.
Fascinating, actually. Or would you like to add anything to that, or do you want to wait and speak about that a little bit later?
I can just add a couple
Okay.
more comments. Beth did a phenomenal job in outlining some of the data as well. There are also issues, particularly around healthcare facilities, in looking at emergency preparedness, which is actually becoming a very important issue. I was at a meeting a few weeks ago with not just public health planners, but hospital and healthcare folks to look at how do we prepare for the next Hurricane Sandy or Hurricane Katrina, and what are those things, not only that the hospital is contributing to climate change, but how do they best react to this and gear up, if you will, for those times when we're least expecting something to happen. And I think nurses play a frontline role in that as well, in thinking about how to best use resources, triaging, all of those things that we don't want to think about, but we need to, because as we're discussing this, the hurricanes are stronger and longer, and wildfires are stronger and longer, and we really need to put a human face on climate change in a way that we anticipate and prepare for these extreme weather events that can create destruction in some cases.
Thank you. Actually, all three of you really. We have a program in the Climate Reality Project called the Leadership Corps, and you all are officially inducted because there's no need for you to be trained. You're doing extraordinary leadership work. Let me go on to the next question, which really follows very directly in what we're talking about now, which is change agents. And so talk a little bit more directly or specifically about the kind of work that nurses are already doing at the local, state, regional, and national level in response to health effects of climate change. Gary did that a little bit when it talked about the EPA rule, but there are many others. And let's start first with you, Laura, and then transition to Beth.
Okay. I wonder if Gary wants to make a quick comment about healthcare and climate resiliency as we're moving into the local, state, regional, and national levels.
Yeah, it's just a quick thing, Maggie, is that, because Laura brought that up, is what we found in Hurricane Sandy is that the hospitals that had on-site power called cogeneration or combined heat and power, they were able to stay open for more than a week once the grid went down in New York City. And that the hospitals that didn't have on-site power and in fact had their electricity in the basement and their backup systems in the basement, they got flooded and essentially they were evacuated. So what's really interesting is that one of the ways in which we need to make healthcare resilient so it's the last building standing as opposed to the first one to go down, and the kind of technological innovation that would help that is also a very, very important energy efficiency strategy. So if a hospital installs combined heat and power generation, they typically save 35% of their electricity costs. And it's the thing itself that will make them more resilient in the next Hurricane Sandy.
Fascinating, actually, and such a common sense connection between the role that hospitals play in any, whether it's just a real illness or, as both Laura and Beth have spoken of, these extreme events that come as a result of climate change. So, Laura, why don't you pick it up from there?
Sure. And so the slide we're looking at says nurses making a difference, and this is just a glimpse of a few things that are going on nationally, but there are also things going on worldwide in the nursing community. I'd like to point out the Alliance of Nurses for Healthy Environments, and the top left-hand corner of the slide is a group of nurse researchers, some of whom are looking at climate change as well as its health impacts. I've had the privilege of working with the DC Department of Health to work with low-income neighborhoods, particularly families with asthmatic children, to help figure out how best to communicate risk and to promote health that would prevent children from having an asthma attack, for example, during a high ozone, high pollen day, and keeping them out of the ER. So really using a public health approach and working alongside community residents to help better understand what they need. The photo in the right upper corner of the slide is a group of women in the West Lawn neighborhood. Again, I worked in Wisconsin a few years ago, and we talked about the importance of climate change on asthma. This was one of the events funded through the EPA's CARE program. CARE stands for Community Action for a Renewed Environment. The community in the lower left-hand corner of the slide is the largest public housing development in the state, and actually got to a point through this funding mechanism to not only have community events to bring awareness to poor air quality and climate change and how to prevent illness, but also to look at the structure of the buildings and to create some neat ideas related to green buildings, such as green roofs. And so they're continuing to work with the public housing and the Housing Authority of Milwaukee to come up with some revisions to those units. The lower left-hand corner is Adaptation Clearinghouse, which is a whole series of toolkits produced by the Georgetown Climate Center. I mentioned the heat event in Chicago several years ago. This aims to help communities and cities, particularly urban communities, to prepare and to adapt to these continuing changes that we're seeing, such as heat. And so there's a lot of good work going on in various neighborhoods, but also the Healthy Hospitals, Healthy Planet, Healthy People Guide for folks working in healthcare settings, produced in part by Healthcare Without Harm, provides actually a more global look at what we can do. And Beth, you want to talk about turning the tide?
Yeah, Beth, we'll need to probably do that quickly. There's so much information to share here. We're actually running a little bit out of time, but we really do want to hear a little bit about this Turning the Tide program.
Sure, thank you. Turning the Tide is a conference that we've developed to talk about the intersection of the natural environment and human health. And this is through our hospital. It's usually a 3 to 4 day conference, and this year, 2013, was our 3rd annual. And this time we focused on the impacts of climate change and human health. And I think it's a really important topic, of course, for a couple of reasons. One is, even though it's been more prominent lately to hear human health in the mix of climate change conversation, it still often seems to be an afterthought. And I think the more we can bring that in, because these are significant impacts, the more that might help motivate humans. And then secondly, to educate and continue to draw in clinicians to that conversation is important, because clinicians are so busy, they don't often feel like they can't impact something as global and huge as climate change, and yet we know that, as Gary said, nurses are the most respected profession, and we know that physicians also, oftentimes their patients actually do what they say and suggest. And so to work that into our lexicon of conversation that we share with the public, with each other, and with our patients, I think is crucial. So the Turning the Tide conference was really about those two things, for public education and professional education. We had great speakers, Dr. Jonathan Patz, and I got tremendous feedback about it. Thank you.
It sounds fabulous. What a great event. So that really takes us to the next and last question that's coming from this webinar as opposed to from our audience. And you've begun to answer that, and some of it is really, you know, through your work is obvious. But let's talk a little bit for just a minute about why is it so important for nurses to be involved, the role of community collaboration at all levels. It's very unique and I think very powerful. So it would be great for both of you to just take a minute to give us some insights into that.
Yeah, this is Beth. And as we've said, nurses are the largest group of healthcare professionals. Gary said there are 5 million healthcare workers. Well, 3 million of them are nurses, and also the most respected, also everywhere. We often are translators. We can translate difficult information to something that people can understand well. And we are guided by, we have a professional standard number 16, that says the registered nurse practices in an environmentally safe and healthy manner. That is strong guidance. Not every nurse is aware of that, but that gives us professional mobility really on some of these topics. And also we're guided by the precautionary principle. It's just common sense to nurses that it's easier to avoid a problem than to fix one after it's already happened. So for some of these reasons, we're naturally predisposed to work well with some of these complex topics that climate change is emblematic of. And I think because of our position around the nation and around the world and our respectedness, it's just incredibly important for us to be involved. Thank you for offering that to us.
Oh, well, no, it's so the work the two of you are doing makes it so obvious, but it's clear that the 3 million nurses, what a key role that nurses will have, already do have, and will have going forward. Laura, would you like to talk with us about it a little bit too, from your perspective?
Sure. So the last 2 slides takes a worldview at why collaboration is important, and this first slide really takes a look at the health impacts of climate change, and you'll see that the North American diagram is squished. It's very small, meaning we're not as impacted by health as, let's say, the continent of Africa. If we flip to the next slide, we'll see that the greenhouse gas emissions by country is reversed, so that the North American diagram is swollen because we're creating a lot of greenhouse gas emissions. And the continent of Africa, you can't even really see. And so one of the things that we need to think about is, not just as nurses, but as a world society, is, you know, the value of the common good, which is a good old public health principle, along with prevention, protection, and promotion of health. And so as we begin to move forward and connect the dots, and as I said earlier, putting a human face on climate change, we really need to look at the range of impact that this is having and the benefits that we will see. Next slide. So we can talk about our individual actions, maybe taking public transportation, using renewable energy, solar, air, wind power. But in the center of this slide and on the lower part of the slide is President Obama. I had the privilege of seeing him speak last week about climate change. And one of the most striking comments he made for me personally was that we don't need to choose between the health of our children and the health of our economy. It's actually, there's quite a bit of data collected and analyzed that shows that the Clean Air Act actually increased the size of the economy and actually reduced health impacts as one of the co-benefits. And so we need to be strong champions of the Clean Air Act and of educating nurses and the broader society about those health impacts. Thank you.
Well, your work is obvious how critical that is. That's the end officially of the webinar presentation. There have been some extraordinary questions rolling in from this great audience that's sharing the webinar with us today. We really only have time for one, unfortunately, that we can share with everyone on the air. But and it really ties together all that you've said and all that you're doing, which is clearly nurses and hospitals are powerful change agents and are already doing important work on climate change at very broad levels. How do you think we can leverage the power of the work that you're already doing towards a broader set of solutions, not just about hospitals, but about actually changing the infrastructure that we need to make a cleaner and more sustainable future for everyone? Gary, you want to take that?
Yes.
Or whoever, whichever one of you. It's a big question, and you're all welcome to give it a shot.
Well, I'll start with a couple of thoughts and then turn it over to Beth and Laura. But one is that we need to internalize the full cost of the fossil fuel economy that we have, so that if we start taking into consideration the health impacts and the social impacts of our addiction to fossil fuels, which have never really been calculated in policy, we would see that our reliance on fossil fuels is costing us much, much more. And so the idea of cheap oil or cheap gas or cheap coal is really a fallacy, because we're paying with healthcare costs, is one. And if we also internalize the cost of these incredibly expensive and damaging extreme weather events, whether they're tornadoes or hurricanes in the Midwest, heat waves that destroy some of our crops, Hurricane Sandy, which is estimated to be more than $50 billion in cost. As we internalize these things, we realize that our reliance is really beyond acceptable on fossil fuels, and it makes a very strong case for this transition to renewable energy. So obviously, we need to put a price on carbon, because all of those things are externalized. All the social and environmental costs and health costs are externalized onto the rest of us, while the industries producing this power get to seek the profits. Second, if we can start to do that, we can mobilize communities around the country and around the world to move away from coal, to move toward renewable energy, and to really see that it's all about creating a healthy economy and healthy communities. It really isn't a contradiction. In fact, it's the only way forward, is to build a green energy, toxic-free economy so that we can thrive in our communities. And healthcare has an enormous role in that story, because they are the anchor institutions in many, many communities in this country and around the world, biggest employers and the largest safety net for us when we get sick. And I think the last thing I'll say is that we're starting to see a fundamental sea change in this country, and it links to the healthcare reform, is that for the very first time, we are asking the healthcare sector to start addressing population health and not just see their role as addressing individual disease management once people are sick, but to really move upstream and to understand the social and environmental determinants that are making people sick in the first place. And as we make that big turn, we will see how valuable it is to move toward a green energy economy, to a toxic-free economy, to an economy that has local and resilient agriculture. So I'm very hopeful in that regard.
Well, you make us all see the possibilities and the optimism involved. Laura, Beth, do you want to add one or two quick thoughts at the end here?
This is Beth. I would like to just say that from the nursing perspective themselves, I think about this a lot. How can we leverage the power of nurses? And I think we're going to have to approach it from many angles, including this topic in nursing education, as I mentioned, and in licensing. Just as if we would expect the nurse who's ready to practice to understand the respiratory system, we would expect the nurse ready to practice to understand environmental impacts on health. Also, to continue to create learning experiences for nurses through their professional groups. Many nurses are involved with professional organizations and conferences. To create opportunities for nurses to participate in community events for planning and relief, and also for nursing researchers to explore these issues. I think that, at least in terms of nursing, as long as we continue, and we being a very large we, to beat the drum, nurses will feel more empowered to learn and act on these pressing health risks. Thank you.
Thanks, all three of you. This has really been an extraordinary webinar, just the beginning of a very big conversation, but one I think all of our listeners will be happy they joined in on. For more information, there are fact sheets on the health impacts of climate change, of course, at the Healthcare Without Harm website, noharm.org, at the Alliance of Nurses for Healthy Environments at envirn.org, and at our website, climatereality.com. I want to thank you all and want to share with you that this fall, on October 1st and 2nd, our third annual 24 Hours of Reality will focus all on the price of carbon, how we are paying already this high price in healthcare costs and in numerous other costs. We're going to travel around the world to tell that story, and we will, of course, ask these three extraordinary people to help us with that event, and so you'll get a chance to see them as well as hear these stories and others this fall. So thank you all. Congratulations, and appreciate all the work you're doing and for joining us today. Don't forget, everyone that's on the webinar, to talk, tweet, share, and post, because beyond the great work that these amazing people are doing, it's our job to talk about climate change and to understand the power that the price of carbon is on us today, and as Gary said, that it's time to put a price on carbon. Thank you all.